our COVID-19 response in light of the very sobering news that we received over the weekend from various jurisdictions. First, we know that Ontario on Sunday reported its highest daily count of new COVID-19 cases since the beginning of the pandemic. Quebec reported its biggest single-day increase since January 17th. Alberta posted a single-day record of new variant cases. And British Columbia reported that its ICU cases were up 63% and hospitalizations up 53%. And we have also heard Dr. Tam warning that we could soon surpass the peak that was reached in previous waves of the pandemic. And so as we look at this third wave of the pandemic, and we see that we are in a third wave of the pandemic, we see that our response is not sufficient. We need to accept without partisanship that the current strategy is not working, and we need to again be asking ourselves the question as politicians, as members of parliament, as political leaders at various levels of government, are we doing all that we can? The response from the Green Party to that question is we could be doing more if we were working more closely together. We could be doing more if we were coordinating more closely across levels of government. Our opinion is that every single aspect of the pandemic response that would benefit from a coordination across jurisdictions should be coordinated. As many of you will know, we have been calling since November for the creation of an intergovernmental COVID-19 task force that would be composed of and led by health experts and officials across levels of government and jurisdiction that would be mandated, as I said, to identify all of the areas of our COVID-19 response that could and would benefit from a coordinated national strategy, and then to develop the strategies in those areas. And those things, of course, have ranged throughout the course of the pandemic across themes like ensuring that there is a national infection threshold to trigger predetermined directives, ensuring that we had national testing and tracing protocols, a unified national coding system to avoid the confusion about messaging, particularly between regions and particularly between provinces, to ensure that we had a unified strategy with respect to vaccine prioritization, and the list goes on. But we have seen and continue to see that there are key aspects of our COVID response that would protect people better, that would limit the spread of the virus, that would help us to emerge from this wave more quickly, that have not been coordinated. And we have seen how we've been suffering across Canada as a result of that. And for those who say that this is outside of the jurisdiction of the federal government, my response is that this is an issue of national concern. And when there is an issue of national concern, most certainly the federal government has a role to play. We saw recently with respect to the Supreme Court judgment on carbon pricing that there is a recognition that certain issues are extra provincial by their very nature, in that they impact the decisions of one province, or the decisions or the action or lack of action of one province has an impact on other provinces. And that there is a regulatory role, or a role of convening at the very least, that the government, the federal government has to play, exactly because every province and every jurisdiction needs to contribute towards the national effort. And so applying that standard and that logic, we have to recognize that the COVID pandemic is an issue of national concern that certainly has an extra provincial component, whereby the actions or inactions of one province has an impact on other provinces. And therefore, the federal government should be certainly working to convene a national response. I note that this invitation still has not been extended.
I know, I think it's an AJA setting.
To the provinces. I think that that is the very first place to start, just a simple invitation to each of the provinces to convene with the federal government to discuss how this task force could be created as quickly as possible and how it could get to work. This would be in keeping with the United States, where, of course, the states have jurisdiction over health there as well, but where this did not prevent President Biden from creating a national COVID coordinator to create a unified national response at the federal level, recognizing that a comprehensive approach was needed because this was a national crisis and that it required a national strategy. And so I again, on behalf of our party, who has called for this intergovernmental task force since November, who called for an emergency debate on these new variants at the beginning of February, exactly because we knew we needed to have a coordinated national response to limit the impact of these variants, and who has continued to call the prioritization of the communities who are most impacted by COVID at this time and where we can prevent the spread most effectively. We continue to make those calls. We continue to stand ready to do our part to support those efforts. We hope that the focus of all federal parties will be where it should be in this incredibly dangerous third wave, which is on protecting the people of Canada and working together cooperatively to do that. Alors, les statistiques du week-end sont très graves. L'Ontario, on note que l'Ontario, en ce moment, a eu le plus fort taux de nouveaux cas depuis le début de la pandémie, que le Québec, maintenant, le week-end, a eu le plus grand croissance dans les cas du COVID, que dans le cas d'Alberta, ils ont eu leur plus grande journée dans le taux de croissance des cas attribués au nouveau variant. Et les cas de soins intensifs sont élevés de 63% en la Colombie-Britannique. Alors, il faut accepter que notre stratégie ne fonctionne pas et il faut retourner à la table pour demander qu'est-ce que nous puissions faire de plus pour protéger les gens ici au Canada dans cette troisième vague. Le Parti vert a réclamé depuis plusieurs mois, depuis novembre en fait, la création d'une task force intergouvernementale, d'un panel intergouvernemental pour coordonner tous les aspects de notre approche, notre réponse à la pandémie qui mérite une approche coordonnée à travers les niveaux de gouvernement. Et on voit maintenant dans la troisième vague que l'absence de coordination des thèmes clés comme la prioritisation des vaccins, comme des conseils pour les voyages interprovinciaux, comme les messages sur l'utilisation d'équipements de protection, tout ça a créé plus d'infections, plus de confusion qui vraiment était nécessaire dans le cadre de la pandémie. Alors, on le demande encore, nous sommes là pour le soutenir et on dit que ce n'est pas une question de le gouvernement fédéral de rester à côté. Le gouvernement est tout à fait capable d'envoyer une invitation à ses homologues provinciaux pour leur demander de participer dans une task force intergouvernementale. On sait que c'est une question extra-provinciale aussi, où les actions ou même l'inaction d'une province a un impact direct sur la pandémie dans une autre province. Et on sait aussi que chaque député représente une circonscription. Chaque député a une responsabilité d'être là pour militer pour leur communauté. Ils ont cette responsabilité. Et finalement, on note qu'aux États-Unis, qui ont un système aussi où la santé publique est une responsabilité des États, que le président des États-Unis n'a pas hésité de créer son propre task force, de créer un coordinateur pour le COVID, pour assurer qu'il y aura en fait une réponse compréhensive, coordonnée au niveau national, exactement parce que c'est une crise nationale. Alors, j'invite le gouvernement, notre Premier ministre, d'inviter ses homologues à une réunion d'urgence pour considérer comment nous allons sortir le plus vite possible de cette troisième vague. Et nous sommes là pour participer dans un esprit de coopération dans ces efforts. Merci beaucoup. Thank you very much.
Thank you, Ms. Paul. This concludes today's press conference. Ceci conclut la conférence de presse d'aujourd'hui. Merci beaucoup à tout le monde. Thank you, everybody, for joining us.